A very warm welcome to everyone joining us today from across India and around the globe. So we are honored to have your presence at official virtual launch of Project Krishna, a noble initiative by Squad Medicine and Research. Let me begin by briefly introducing who we are. So Squad Medicine and Research SMRs was started as a small WhatsApp group in April 2020 on April 2020 and officially registered as a non-profit trust in April 2024 under the government of Andhra Pradesh and Niti Aayog. Over the past 5 years, SMR has mentored over 1,000 students, launched impactful research projects, and built a collaborative ecosystem of healthcare professionals, students, and scientists. SMR mission is to build the next generation of physician scientists and to drive research that transforms healthcare delivery in India and across the globe. And today, we proudly launch the Project Krishna. This project is deeply personal. It is named in the honor of my father, who is courageously battling cancer. And the Project Krishna reflects the commitment to cancer prevention, early detection, health promotion, and patient centered advocacy. Project Krishna aims to bridge the gaps in cancer education, screening, and care through community based interventions and through awareness campaigns and research initiatives. So, today we have our esteemed guests. We are incredibly honored to be joined by our two esteemed guests whose presence adds immense value to this launch. So we have Dr. Rakesh Reddy Boya, Senior Consultant, Medical and Hemato-Oncology, Apollo Cancer Center, Visakhapatnam. And we have Dr. Jitendra Kumar Meena, Associate Professor, Preventive Oncology, National Cancer Institute, AIMS, Jajjar, and New Delhi, India. So let me begin with introduction of both of our speakers today. Dr. Rakesh Reddy Boya sir has completed his MBBS from Andhra Medical College, Visakhapatnam, and his MD Pediatrics from PGIMR, Chandigarh, and his super specialty DM in medical oncology from prestigious institute AIMS New Delhi in 2016. He pursued ESMO certification in medical oncology and received gold medal from Indian Society of Medical and Pediatric Oncology for the best outgoing medical oncology postgraduate in the year 2016. He further got specialty certified in medical oncology by MRCP UK. His special area of interest is stem cell transplant, hemato-oncology, pediatric oncology, immuno-oncology, and being veterinary in field of treated over thousands of patients of breast, GI, head and neck malignancies with curative intent. Sir has been instrumental in establishing the largest stem cell transplant unit in Andhra Pradesh and done his first haploidentical stem cell transplant in Andhra Pradesh, first transplant for thalassemia major and sickle cell anemia in Andhra Pradesh, and treated over 1,000 successful BMTs. Recently, he added new armament to his arsenal as CAR T cell therapy and successfully treated the patient, including my father. He has numerous papers and research publications to his credit and has been principal investigator of numerous clinical trials and research trials. He is a member of ESMO and American Society of Clinical Oncology. Today, we feel very proud to have Sir as a guest speaker. Thank you so much, sir, for joining us.
Thank you, Taran.
Next, we have Dr. Jitendra Kumar Meena, sir, who is Associate Professor, Preventive Oncology, National Cancer Institute, Jajjar. Dr. Meena sir finished his MBBS and MD from MD Community Medicine from MAMC, New Delhi, and DNB Preventive and Social Medicine from NBE. Sir has PG Diploma in Health and Family Welfare from NIHW and residency training at prestigious institutes like AIMS and PGM at Chandigarh. Sir has certifications from Advanced Medical Education NMC, Health Safety Environment IAPH Gandhinagar, and Leadership and Health Management University of Washington, USA. Sir has numerous awards and grants, which includes NCD research grants by International Diabetes Federation, International Society on Hypertension, and International Commission on Occupational Health. Sir has fellowships from Global Mentorship and Fellow Award 2019 by International Association for Study of Lung Cancer for training in cancer epidemiology and prevention at Catalan Institute of Oncology, Barcelona, Spain. Sir held prestigious membership from National Academy of Medical Sciences, Indian Public Health Association, Indian Epidemiological Association, ICOHS, European Society of Medical Oncology, and American Society of Clinical Oncology. Sir has numerous vast research experience. Sir has more than 15 years of research experience and awarded research grants by ICMR and AIMS and global funding agencies. Sir is also an editor at PLOS ONE, frontiers in public health and many prestigious international journals, and also works as a reviewer for several international public health journals. Sir published more than 85 papers in peer-reviewed journals and has authored 5 books. So today we feel very proud to have you as one of the guest speakers, sir. Thank you so much for accepting our invitation.
Thank you for the kind introduction. Thank you.
Okay, now we are going to proceed with the formal launch. So I would request uh, the guests to start the countdown when I say start. So let me share the screen for the AV. Vignesh, can you confirm? You can see the screen, right?
Yes.
Yeah, we can see the screen.
Okay, okay. Thank you so much. So I would like to request guests, chief guest, to proceed with countdown.
3,
Three,
2, 1, go.
two.
Yeah, thank you so much, sir, for the launch. So now let's hear like through the words of our esteemed chief guest, like what how was their journey in their academic journey or the clinical journey or research journey, and how their clinical practice or research shaped the path of cancer. So let us begin with Dr. Rakesh Reddy, sir.
Thank you, Tarun. Good evening, you all. At the outset, I would like to congratulate SMR Group, Squad Medicine and Research, for this very noble initiative, novel initiative, especially coming from such young group of students. All of them must be years junior to us, and they left me feeling why I didn't do it in first place, why I did not have this idea in first place. So to have an idea like this requires a will to do, to journey into the unknown and to battle something as big as cancer. And if you see Project Krishna, which Tarun has rightly titled after his father, whom I know personally, as his treating physician, and who has been battling this very aggressive form of lymphoma very bravely, the entire family, in fact. The titling that project as Project Krishna, honoring his father's battle against this cancer, and subtitling it as an attempt to defeat cancer. It's a noble and huge initiative at the same time. And we need more of such kind of like-minded people if you are able to do any impact in terms of global health and cancer related outcomes, because it is not a single country's problem. It is truly a global problem. I'm sure Dr. Jitendra will have even better words to describe that. But as a cancer physician who has been in this field for close to 15 years now, the way I have seen this disease grow from being something rare in certain households to now almost every household harboring a cancer patient. I'm sure everyone listening to this would agree with me. Now, there is at least one patient of diagnosis of cancer in every household. It might not be in one single family. The household means a family, and it's their first degree relatives or a close cousins, or you would have diagnosis of cancer in any one of your close relatives. So it has grown to such an extent that it has become a number one public health program now, public health issue now, without any doubt, and it's continuing to grow. And this is despite the fact that cancer is so vastly underreported, only I guess about 10% of cancer cases actually get reported. It is getting better as the government is making more and more stronger initiatives to get cancer reporting much more robust. Then we will have adequate, more clear idea of what actually is the burden of the problem is. But whatever numbers that ICMR projects is actually an yeah, only the top of the iceberg. There is the tip of the iceberg. The bottom of the iceberg is actually larger. So why is this? When I say defeating cancer is such a, I mean, daunting task, that's because of the fear of the word of cancer in public. As a cancer physician, that's what actually saddens me most is still when a patient when I make a diagnosis of cancer, I cannot freely discuss it with the patient. The patient's family will come and say, please don't disclose that it is cancer. There is so much fear about this word cancer in public. Some of it is real fear, some of it is perceived fear. Real fear is a patient might be worried the treatment is toxic, the surgery is morbid, the radiation leaves you with scars and so much of long-term side effects. Some of it is real fear. Some of even we agree that some of these treatments are toxic, but some of it is perceived fear. It's just their I mean, the fear factor that is associated with a word rather than the treatment. A small breast lump can be easily be treated by a minor surgery with little or no additional treatment. And actually, the patient will be a survivor with very little treatment and no other treatments that are given throughout life. So that perceived fear still it comes from this stigma associated with the word cancer. Even today, when I made a diagnosis of cancer in a doctor, I was immediately, his friend calls me up and says that please don't discuss this among your community. Otherwise, you know how much the stigma is there. I was very, very surprised that even among doctors, there is so much of stigma still about cancer. So, first, we have to remove this fear of word of cancer, fear about the diagnosis of cancer, of the treatment of cancer from public. And it has to start from medical community. It has to start from youngsters like Tarun and his colleagues, and I'm glad that they have taken this initiative. And my advice to them is once they set out to defeat cancer, the first thing is to remove the fear of cancer, because the fear comes from fearing the unknown. If you don't know who your opponent is, everybody will be afraid that maybe it is a battle that cannot be won. But once we know once the unknown becomes known, once patients or public knows about cancer, knows about how it is diagnosed, how it is treated, what are the latest advances that has happened in cancer treatment, be it medical treatment, surgical treatment, radiation treatment. So much advances have come up, and previously about 10 years back, the outcomes that we used to see in some of the cancers that are used to be so dismal, less than 1 year, consistently we are crossing 5 years, 6 years, 10 years, curing majority of the patients. So once you remove this fear that this is cannot be a treatable diagnosis, a word of diagnosis of cancer equals to death or no treatment. Once this myth is broken, that is only through education, only through knowledge, only through awareness. And that is what your primary intent of this project Krishna, one of the primary intent should be. The one last parting comment is I find Tarun's enthusiasm for research very endearing, research and publication. Something that we as his just senior generation couldn't do as much. I'm sure the youngsters are more aware that publishing research is very important. Cancer is one area where there's massive ongoing scientific research. I think as the most populous country in the world, we should lead rather than other countries in the world that are leading now. At least with the initiatives like this, with this kind of projects, I'm sure it's going to happen. So please remove the fear from the word of cancer, educate, make people aware. Do continued scientific research, and I'm sure you'll be very well on the path of success in defeating cancer. And with this, I congratulate SMR for this great initiative and wish you all the success.
Thank you so much, sir. Thank you so much. It was a wonderful speech, and we make note of all your inputs. Especially, we will definitely try to remove the fear of cancer among the community through our community level initiatives, and we will continue to do our research. Thank you so much. And now we will go to Dr. Jitendra, sir. Uh, so please take the stage and pass your views.
Thank you, Dr. Tarun. Uh, I think like Dr. Rakesh has really, hit on the target because awareness is one key area where like we are actually lacking. And I should really congratulate SMR team, for taking up this initiative. Big congratulations to all of you, because although there's a curiosity among people, but nobody's taking concerted efforts or grouping up to really in a scientific manner to actually against this incremental challenge of cancer in our country. I think very aptly titled Squad because cancer, it's a notorious enemy and we need to really actually gang up against it. So I think I really like this term Squad actually. It's very appealing also. So to fight against a notorious criminal, we need to really actually squad up. And I have a personal affiliation to Krishna. I had interaction with Dr. Tarun before also, and um, his father, the survivorship of his father, and I'm really glad, he's taken it to heart and set up this initiative. I actually belong to the holy city of Mathura, so very well linked to the Lord Krishna actually. So I'm also personally involved in this. So when I got to know about this, it actually caught my attention and interest, and I really want to thank you. Just to say, because as Dr. Rakesh was telling, the stigma is a major challenge that we are facing. So what happens is like even the patient who eventually, if they are lucky, they are turning up to the right facilities for cancer care, they sometimes lose to follow up. So all the efforts which have been made for their treatment planning and all that, that goes into vain. And there's a lot of miscommunication, misinformation, which is there. A lot of people commit alternative management, and then they promise like good results, and the patients do not follow on the right scientific approach for the treatment, and the disease progresses. So not just we face the challenges in the aspects of cancer prevention, but optimal management of cancer also. Um, we really actually need a lot of efforts as SMR, which is being made. You people can work on, yeah, definitely, as said, cancer awareness aspects, destigmatizing the disease, and also, setting up a registry of, listed practitioners who are working in oncology, who are, there's a referral network which should be there. Not every patient should have to be, following up and going to the long distances for treatment. Sometimes because of lack of awareness, they don't know that there are nearby good care providers who can provide them. So the referral pathway management is also, I think, very important. They need not to go to the tertiary oncology centers all the time. Maybe on the follow-up care can be taken up by a nearby, oncologist, or, some practicing physician who's trained in oncology. So because there's a dire dearth of oncologists in our country, and they will never be enough given the burden and the incremental burden of cancer happening in our country. So we all need to come together, brainstorm how effectively we can, take care of the people who are at risk of developing cancer, screen them early, detect the cancers early, and make sure that they are treated well in time with optimal referral management. So I think these are key areas, but definitely cancer awareness can play a major role. People need to be aware that early detection is very key to cancer care. And people with early stages should not, delay on their part, and definitely go and reach for the right treatment in the right time. So I think you people with full of energy, full of like research endeavor. Definitely take these key questions which are like challenging us all, and how optimally we can modify our health system so as to provide the best of the care to these burgeoning challenges of the incremental cancers in our country. So kudos to you all the very best to the efforts, and all of the whatever best I can provide support in any of the aspects, I will be glad to do. Thank you.
Yes, sir. Thank you so much, sir. That was very insightful. So definitely we work towards the registry aspect and the research aspect. And one more thing I want to add, like after your information, like while before like we approached it, we consulted Dr. Rakesh sir. So like I personally visited Tata Memorial Hospital, AIMS Delhi, and CMC Vellore. What I understood after visiting all like premium central institutes, like what I realized and after consulting Dr. Rakesh sir, I think now the cancer care and the physicians with that expertise are really there in almost all good cities. So we need not to be go to only premium care centers to get the best diagnosis, best care. So even as a doctor, initially when I said like we will take the treatment here in Vizag because we will get good family support and care here nearby town. Most of the relatives suggested like, no, why are you wasting your efforts here? Go to CMC, go to TMH, go to AIMS Delhi. I definitely agree. Those are premium institutes, and the care and the things, the diagnosis or the supportive care which we receive in those institutes will definitely with par excellence. And that doesn't mean we won't get those at the like tier two cities or local cities like Vizag. So we felt that level of excellence even there at Apollo Hospital under the consultation of Dr. Rakesh Reddy sir. So even after my father diagnosis, when any other of my colleagues or patients in the relatives who approach me, I definitely suggest them to get at the nearest town because we have that equipment or the expertise or the excellence or the innovation or patient care here itself. So that's the one aspect which we will definitely focus. And thank you so much for your insightful talks. And now let's proceed with the like further. Let's explore further like what is exactly Project Krishna, what is our mission, what we will focus on it. So let me share you the share. Let me share the PPT. Vignesh, can you see the screen?
Yeah, Taran.
Yeah, yes, I can. Yeah.
Okay, great. So like through Project Krishna, we are focusing on like four important aspects, which is one is awareness and education. So one is cancer prevention, one is research and innovation, one is like which is I felt very unique compared to any other initiatives like patient and family support. So let's see further what is Project Krishna. So Project Krishna, led by SMR, is a noble initiative committed to transforming the landscape of cancer care by uniting scientific innovation with human compassion, rooted in both personal legacy and scientific responsibility. So we aim to unite research, awareness, and action in global fight against cancer. As you all know, it draws its name from my father, uh, Krishnamurti, so who is courageously fighting against cancer right now. And our mission is to detect cancer early through accessible diagnostics, screening innovations, and community-based surveillance. And next step is prevent cancer by promoting healthier lifestyles, environmental awareness, and risk-reducing interventions across populations. And we try to defeat cancer by accelerating access to effective treatments, empowering patients with knowledge and supportive care systems. How we do this? So we aim to plan public education and cancer awareness through sustained campaigns, media outreach, and school or community engagement. Preventive health programs and community health camps, which offer screening, consultation, and early intervention. And the unique one, which I said, holistic support for patients and families. So we ensure that access to treatment, knowledge, psychological resource, and informed care pathways. So we believe that so many people, despite there are wide range of available treatment options or diagnostics, they don't have sufficient knowledge or they don't know anyone to guide to approach whom, which institute or which doctor. So we aim to help them to make aware of various diagnostics and various treatment options available so that they can take the best one and they can defeat the cancer. And finally, one of the core objective of SMR, research and innovation projects aimed at bridging the gap between discovery and real-world applications, which by ensuring scientific progress is translated into clinical impact and policy reform. So I want to just brief some of the projects which are currently happening and planning under Project Krishna. And we have Vignesh, who is working on cervical carcinoma, systematic review. And we have Dr. Keshavi, who is couldn't join today's meeting. So she is working on the landscape of cancer vaccines. So she is trying to compile all the information and to use it for public dissemination and research purpose. And we have also recently we have planned 4 or 5 research articles like which related to basic science, like systematic review and meta-analysis, aiming few top conferences which will prospectively aim for publication. And simultaneously we need help and we need support. We will take support and inputs from our esteemed guests today to identify the key areas where which we can focus on research. We will try to do some large scale studies on like original studies at community level, at the clinical level, through with support of our esteemed chief guest. And last month I visited WHO IARC, International Agency for Research in Cancer, where I have discussed about the where I have discussed about the various opportunities and collaborations to plan at the national and international level. And I'm looking forward for the other SMR members and the common people in the medical community and also like patient community to come forward and support the Project Krishna. And we envision a world where no one fights cancer alone and where science, society, and solidarity converge to stop cancer before it starts or beat it when it strikes. We demand collaboration across researchers, clinicians, patients, policymakers, and communities. And we promote through open data, interdisciplinary research, and global partnerships. Project Krishna aims to build an ecosystem where cancer is tackled early, equitably, and with enduring resolve. Together, let's detect, prevent, and defeat cancer. So I request everyone to join us in redefining the cancer care through Project Krishna. Thank you so much. And now I will hand over the stage to Dr. Vignesh to proceed with the closing remarks.
Yeah. So thank you so much to all our distinguished speakers, supporters, and participants for making this event a success. Project Krishna is not just a program. For me, I too am involved in this personally because my MD thesis is regarding program evaluation, and that program is NPNCD, the National Program for Prevention and Control of Non-Communicable Diseases, which among other NCDs also involves oral cancer, breast cancer, as well as cervical cancer. And I am doing this program evaluation under 2 blocks of Darjeeling district, out of which I am based. So it's a movement towards a compassionate, equitable, and research-driven cancer care. Together, let's detect early, prevent bravely, and fight cancer with knowledge and innovation. Wishing you all good health and continued inspiration. Jai Hind.
Yeah, thank you. I request everyone to please switch on their camera if it's okay, so that we will have a group photo to place it in the social media. And we have my father and mother joined this program. So I requested them to speak, but they are a little bit shy. So I'm glad that they have joined this meeting. So I will wait for 5 more seconds. If anyone want to switch on the phone, they can on. I will take a group photo. Okay. 3, 2, 1. Okay, thank you so much. Firstly, my heartfelt thanks to our both chief guests, Dr. Rakesh Reddy sir and Jitendra sir, for joining us and accepting the invitation and support us. And we are looking forward to your continued support in our further initiatives under Project Krishna, and we are looking forward for the long-term collaboration and support. And I thank my team SMR and all the members of SMR for joining this meeting. So after this meeting, I will share the link. Please share it across social media and tag SMR and Project Krishna. Thank you so much. Have a nice day. Jai Hind.
Thank you.
Thank you. Best wishes. Thank you.
Thank you, Tarun.